Hello friends, I am Dr. Kunal Nath and I am a consultant neurologist and a medical advisor to medical legal cases. Today I will be discussing a very important topic for neurologist as far as thrombolysis in ischemic stroke is concerned. So there is a lot of apprehension among some neurologists that if we thrombolize a patient of acute ischemic stroke, he may develop a intracranial hemorrhage and we may face litigation. So there was a very good review article which I could lay my hands on, which was published by Dr. Archit Bhatt in Providence Brain and Spine Institute, Portland. And I would give all the credit to Dr. Archit Bhatt and his team. So this review article, which is called the Medico Legal Considerations with Intravenous Tissue Plasminogen Activator in Stroke, a systematic review. So I may be, the article is with me and I give full copyright credit to the author, and I will share the citation also for proper credit to the authors. But very important things which they found in the review is that they reviewed more than 7,000 cases of ischemic stroke where litigations were done, and around 46 cases were there where litigations were due to giving or not giving of IV thrombolysis, and amongst that 38 verdicts were there. Some 60 to 65% verdicts were in favor of the defendant, that is the doctor and the hospital, and 30 to 35% verdicts were in favor of the plaintiff or the complainant. So very important points which they found out in this article was that we feel that if we, as neurologists, usually we feel that if there is an intracranial hemorrhage or extracranial hemorrhage due to TPA, then we will be litigated. But this case, this study, this systematic review found out that 36 out of the 38, more than 95% of cases were when thrombolysis was not done, and only 5% of the litigations or cases, legal cases, were due to complications of thrombolysis. So this is a very eye-opening thing for neurologists, that we fear that the complication of intracranial hemorrhage or extracranial hemorrhage secondary to TPA would be the reason of litigation, but actually it was not that. It was not giving thrombolysis, not giving the option, or not taking proper consent, or not giving the reason for not thrombolizing was the main factor which led to litigation in these cases. So my message to, and there are other, I will give the citation of this article, which is very good for all neurologists especially and emergency physicians to see. Emergency physicians were involved in almost 60% of the cases. So not only neurologists were involved in almost 20% of the cases. Hospital was involved in 90% of the cases. So hospital, if they are advertising that we are giving 24/7 stroke care, then they have to be very careful that they have a definite stroke protocol in place. And the emergency physicians, they were litigated the most, 60%. Neurologists were 20%. Then if non-neurology physicians and neurosurgeons were there, almost 17-18%, they were also involved in litigation. Exact percentage you can read from the article. My data may be slightly wrong, but you can read it from the article. So not only neurologists, but mainly emergency physicians should be very, very well aware of the stroke protocols. And a very important thing I found out, that if you do not have the stroke protocol, the referral to the proper centers was a factor favoring the defendant or the hospital. So sometimes when we cannot place a protocol in place and still a patient comes to us, it is better to timely refer and proper referral to a stroke center which is capable of thrombolizing, rather than wasting time in your own hospital and depriving that ischemic stroke patient of the chance of thrombolysis. So takeaway points from this review article was that not doing IV thrombolysis or not giving the option of IV thrombolysis to the patient was the major reason of litigation in ischemic stroke patients, rather than complication of hemorrhage. Secondary, emergency physicians were involved in around 60% of these cases. Hospitals were involved around 90% of these cases. And timely referral and proper documentation was the main factor. One of the factors, I will not say, but one of very important factors which favored the defendants or the doctors of hospitals. So take care about this thing. Thank you very much.